Hi, my name is Lianne, and on behalf of Group 3, our topic is Medicare for All, and we want to discuss if it is the solution to the problem of balancing cost, quality, and access. Before getting into all that, we wanted to talk about the iron triangle briefly, which is the theory that cost, quality, and access are all interdependent, and that changing one will affect the others, and vice versa. So the problems with our current healthcare model are vast, but the biggest one being that we are considered a no system. We utilize 4 different healthcare models to deliver healthcare in this country versus others that utilize just one. None of these systems were meant to work together, so that creates a lot of problems. The first is that there's an increase in cost, and that 2/3 of people file for bankruptcy citing medical issues. The quality actually goes down, and that 3/4 of Americans say that our country doesn't get good value for what we spend on healthcare, and that the access, normally relegated problem to that of lower income brackets, is now becoming a middle and upper class problem as well. There are a lot of different factors affecting cost of U.S. healthcare. Many of them include growing and aging population, increase in chronic conditions, administrative costs, the undereducated population, labor intensity. It kind of goes on and on. To the left are a few graphs, and between the years of 1960 to 2009, we see how much the U.S. has spent in the billions on healthcare, what percentage of that is the gross domestic product, the total per capita or per person, and then how we rank compared to other major countries' healthcare systems in cost. And obviously, the U.S. spends the most money and has the lowest quality care. Speaking of quality care is defined by the World Health Organization as safe, effective, timely, efficient, equitable, and people-centered. And although there are many hurdles to providing quality care, that the quality and appropriateness of diagnostic and therapeutic procedures are the ones that impact heavily on cost. Access to healthcare means both physical access to doctors and hospitals, as well as a patient's ability to afford health insurance. And since cost is one of the biggest issues, it is something that is very, again, interdependent, as we stated in the iron triangle. And that the problem of limited access to healthcare among uninsured and underinsured Americans continues to confound decision makers and healthcare reformers, and has become a moral and economic issue. Many people have argued for income-based rates to help increase access and decrease costs, but whether or not that would be federally or state regulated would be up for debate, since things of that nature, such as welfare, are federally regulated, which decreases access to a lot of people within states with higher costs of living. So what is Medicare for All? It is a single-payer, government-ran health program, usually off of taxes, that allows Americans to have healthcare coverage. It's supposed to lower costs of doctor visits, hospital stays, and emergency room visits. Here are the 9 most commonly proposed bills that are under review right now. They're all variations on Medicare for All, some with subtle differences, others with less than subtle differences, but they all propose to have universal health care coverage funded by the government, and that everyone would have access, and that it would decrease cost, increase quality, and increase access. Here's a graph showing how the 9 of those compare side by side in a couple of different categories. Would there be a tax increase? What are the premiums like? Would people pay for them, or would the healthcare be completely free? Would they be able to choose between a private insurance at work and the government-funded Medicare for All plan? Those kinds of things. It's very important to compare and contrast the bills under review to make sure that whichever one you choose is going to benefit the most people. Medicare for All costs would decrease significantly according to the arguments, because it would eliminate out-of-pocket spending. It would prevent patients from receiving surprise bills. It would protect Americans from rapidly rising premiums. It would decrease administration costs, and it would drop drug prices dramatically, if not capping them completely. On the left is the current U.S. condition for the cost of healthcare, and it is extremely dramatic and very upsetting to look at. And Medicare for All proposes to drop those costs significantly in a number of ways, such as lowering prescription costs, lowering the costs, which would then give people ability to have coverage when normally they would not. It would incentivize efficient care, implement progressive funding, lots of different ways they propose to drop the cost of health insurance. And they state that quality would go up. People would have access to things that they did not have access to, and that those who are now on private insurance would have a smooth transition into Medicare for all, that there would be no drop or lapse in coverage. They would have access to the doctors they see already, and that everyone would have access to this care. There wouldn't be any pre-existing conditions to exempt people from coverage. Again, no exclusions, so no pre-existing conditions. It would improve healthcare for everyone, since everyone would have access. Nobody would be stopped from going to the doctor to get care for something that they desperately needed simply because cost was an issue. Cost would not be an issue with Medicare for all because it would be a government-funded program. But the opposition for Medicare states that the cost would actually go up dramatically. There would be a 70% tax increase. We'd eliminate 1 million jobs. That your pay would actually go down to compensate for the inclusion of health benefits. There'd be delayed development of new drugs and medical technology, and that the out-of-pocket spending for supplemental things such as vision, dental, and prescription would actually go up if it would even exist at all. That same compare and contrast for the cost on the left is now being opposed by the objection to Medicare for all on the right, that state that arguably the cost for Medicare for all would go up dramatically and would actually cost more than our current healthcare system. And that arguably the quality would go down because we are imposing longer delays and delaying new drugs, that people would die from otherwise possibly curable or treatable conditions with newer medications. People would wait longer to see the doctor. They would pay more for it. And that overall our quality would go down because the doctors would be leaving the field. They would not want to stay. It would mean that non-citizens would have access without paying taxes that would go into funding that program. Doctors would lose money, they would leave, and that ultimately the steep tax bill would come down to us Americans paying for our own insurance once again. Some of the solutions would be to drop prescription drug costs and negotiate prices with pharmaceuticals. This is something that Donald Trump, our current president, is actually arguing and attempting to implement for. There's also the option to include a drug benefit with traditional Medicare. You could also stop paying private Medicare plans. You could lower instead of raising the age of Medicare eligibility, or you could even just let the ACA, the Affordable Care Act, do what it was set to do and stop meddling. Some alternatives to Medicare for all are national health insurance or socialized medicine, or, as I stated before, letting the Affordable Care Act do its job. Many people state that we haven't given the ACA time to work, and that allowing it more time would afford us greater improvements in cost, quality, and access. In conclusion, regardless of where you stand, there are many options to choose from, whether you're for or against Medicare for all, if you prefer socialized medicine, or if you would prefer to stick with the current Affordable Care Act. It's important to evaluate how they all rank next to each other. And that no matter what you end up choosing, that you consider this is not just coverage for you, this is coverage for everybody. How can we implement a healthcare reform that will have the most impact in the best way for the most people? Thank you for listening to our presentation. I hope it's been informative. Here are our references. And thank you very much.